Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is September 4th, 2025. This video is on a JAMA article published online September 1st, 2025, titled Helicobacter pylori screening after acute myocardial infarction, the cluster randomized crossover HELP-MI SWEDEHEART trial. Upper GI bleed is a key complication of post-myocardial infarction, especially those on DAPT, dual antiplatelet therapy. Helicobacter pylori infection, common in cardiovascular patients, is a known risk for upper GI bleeds. This study was a nationwide Swedish open-label, 2-period, 2-sequence cluster randomized crossover trial using SWEDEHEART registry data across 35 Swedish hospitals, 18 clusters. Intervention: urea breath test screening for Helicobacter pylori during acute myocardial infarction hospitalization. Positive results resulted in a physician-guided eradication. Sample size: 18,466 patients with acute myocardial infarction were enrolled. Mean age 71 years. 71% were male. 9,245 were screened versus 9,221 got usual care. Follow-up: median 1.9 years, maximum 3.2 years. Statistics: intention to treat analysis with a negative binomial model. The primary endpoint was upper GI bleed incidence. What did they find? Upper GI bleeding incidence was 16.8 versus 19.2 per 1,000 person years. Rate ratio 0.90, p-value 0.18, no statistical significance. Screening did not significantly reduce upper GI bleed overall. Subgroups: screening reduced upper GI bleed in those with anemia, rate ratio 0.64 for mild anemia and 0.44 for moderate to severe anemia. P-value for interaction was 0.03. And for CKD, the rate ratio was 0.75. Limitations of the study: low prevalence of Helicobacter pylori, 23.6%. PPI use may mask results. Screening adherence, 70% only. No central adjudication. Key takeaway: routine screening for Helicobacter pylori after acute myocardial infarction cannot be broadly recommended, but may benefit high-risk subgroups, example, patients with anemia and CKD. Clinical pearls from the HELP-MI trial: Helicobacter pylori infection was detected in about 24% of acute MI patients tested. 96% received eradication therapy. PPI influence, proton pump inhibitor influence, high use, 25% at admission, around 50% at discharge, may have blunted both detection and screening effect. Primary outcome: no statistical significant reduction in upper GI bleed in the full cohort. Risk stratification: screening confers significant benefits in patients with anemia and chronic kidney disease. Practice point: routine screening isn't recommended post-MI, but may be justified in select high groups, example anemia, CKD, or no PPI use. Eponyms and named entities in the HELP-MI trial. HELP-MI trial was this trial which is the Helicobacter screening to prevent GI bleed after MI. SWEDEHEART, Swedish web system for enhancement and development of evidence-based care in heart disease. The consort statement is a reporting guideline used for cluster randomized crossover trials. The Maastricht 6 and Florence consensus is a European consensus recommending Helicobacter pylori screening in chronic aspirin users. The HEAT trial is a randomized controlled trial showing Helicobacter pylori eradication reduced GI bleeding in aspirin users. And the Valiant trial identified GI bleeding risk in high-risk post-MI patients, contextualized subgroup insights from the HELP-MI. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.